Medicare has gone up dramatically for middle class people, and especially in this area, along with the prescriptions. What is your mother going to do about looking into that and the price we have to pay?
So thank you for asking both about the cost of kind of medical care insurance and prescriptions. As you may or may not know, when my mom fought for universal health care coverage back in '93, which I remember vividly, and I remember vividly when it didn't work out, part of her original plan was to empower Medicare to negotiate with drug companies so that Medicare, on behalf of the tens of millions of Americans that are enrolled in Medicare, would be using kind of its major purchasing power to drive down the cost of prescriptions for people on Medicare. And the thinking goes that that's not only good for people on Medicare, but it's also good for people not on Medicare yet. I like to think I'm not on Medicare yet. I want to live that long. Because Medicare pricing is transparent. You can go online to the Health and Human Services website right now and see how much Medicare pays for certain things in this area. And because it's transparent, it would be hard for drug companies to charge those of us not on Medicare yet even 3 times as much as they would be charging Medicare, much less 300 times. So that's the first thing we have to get done. Unlike when my mom was fighting for this back in '93, there was bipartisan movement to empower the VA to do that on behalf of veterans. So now the VA negotiates with the full weight of all of our veterans much lower drug costs. A lot of Republicans supported that. If they supported it for our veterans, we should remind them of their support and ask they support this on behalf of our seniors and all Americans. So that is the first thing. On the second point, we have to protect the Affordable Care Act, but finish the part of the affordable. And one of the reasons we have to protect the Affordable Care Act is that the coverage expansion for 20 million Americans, that's not just a statistic. I mean, that's people's lives. And one kind of point that really illustrates that means a lot to me as someone who's still a relatively new mom twice over, is that in 2015 we had more pregnant women access the full complement of prenatal health care services, and more pregnant women deliver their babies in safe environments with midwives and birthing centers at hospitals than at any other point in American history. And that's one of the impacts of the Affordable Care Act. But out-of-pocket expenses, as well as insurance premiums, have gone up too quickly. And so what my mom believes, and this is all kind of outlined in detail on her website, is that middle-class Americans and working-class Americans should get tax credits to defray and cap their out-of-pocket and insurance premium costs every month. And so hopefully that'll get us to the affordable part of the Affordable Care Act, but we can't go back and we can't start over. Yeah. Yes, sir, you've had your hand up too.